Our environment and the stressful world that we live in can often lead to dry eye, which impacts our vision.
Dry eye is critical to address after procedures like cataract surgery or glaucoma treatment or extensive use of drops or some medications. So it's really critical to understand that if you're looking through a dirty window, if the vehicle in your car doesn't have a clear window, then you will not see well. When your cornea is dry or irritated, then of course the vision will not be crisp, and people discount the importance of that. It is critical to use gels, drops, ointments, and various foods and nutrition to make sure that your cornea is not dry. It is really important to be proactive, not reactive to dryness. By the time you feel that your eyes are dry, then it is already in a crisis. So it is really critical that we treat our eyes every day, much like you would treat lotion on your skin, on your hands, and on your face. Often when we talk about macular degeneration, we're addressing a seniors population, and it is certainly important for them to supplement their diet, but it's also more important or equally important for the caregivers and the children of those seniors to be supplementing their diet and preventing disease from ever happening.
When you look at macular degeneration, that too is a growing epidemic, and trying to prevent that disease is important through education. Why? Smoking is a big risk factor. Trying to encourage Canadians to stop smoking or not take up that bad habit will have a tremendous impact on the incidence of disease going forward. There's also a lot of talk in terms of trying to modify the diet. We know that a diet low in antioxidants has been linked to the incidence of the disease as well as progression of the disease, and so it's important to carry that discussion out with patients in a more holistic fashion. I like to think of the research endeavors now in three broad strokes. First off, earlier detection. So there's a lot of research being done in improving diagnostic tools to try and pick up disease at an earlier stage and be able to better monitor disease in a more effective manner. Earlier detection equals better outcomes. The second broad stroke I'd like to paint is that of treatment. We know that these diseases, diabetic retinopathy, macular degeneration, are multifactorial. They're very complex. They have many targets. And right now, while our drug therapy is excellent, the future holds better targets in terms of being more specific. The final, I think the most encouraging area of research is trying to do a deep dive in the understanding of the causes of disease, the risk factors that I alluded to earlier. They are multifactorial, but genetics does play a role in some of these diseases. We're still a far ways away from drug and genetic therapy in that regard, but trying to understand risk factors perhaps will allow upstream prevention intervention and hopefully avoid drug therapy altogether. I mean, that would be the ultimate goal.